more about Hillsborough County Public Schools and see how students like me are prepared for life.
So I started this podcast about writing to help inspire young authors and anybody who needs help with their journey and their creative writing. I started something like this because I've been writing my whole life and I'm really passionate about it, and I just wanted to share my passion with others and get others interested too. I have covered stuff like how to develop a good story, a good character, basically the 5 W's, who, what, when, where, why, and I'm planning to cover more stuff of how to write like different genres of stories and how to make an effective like scary story or something. So I usually make the script 2 or 3 days from before, and I try to make it nice, and then I go to my computer, I load up some editing software, and I start recording using my microphone, and then I just piece all the bits together and make it the podcast. It means a lot because I'm glad that I can inspire the younger grades and even the high schoolers and other grades, and I hope to continue doing this. What I always say to anyone who's struggling or just needs a little motivation, my motto is a little imagination goes a long way.
Hi, I'm Karen Perez, Chair of Hillsborough County School Board. You're watching Hillsborough County Schools TV y juntos estamos preparando los estudiantes para la vida.
Blake is the origin of inspiration and my artistic, I guess, freedom, I would say. A lot of things and a lot of people inspired me to push to get to where I am now. And I honestly believe if I was not surrounded by like-minded and other gifted people, I would not be where I am today with Hamilton. A lot of dreaming started here, so it's very special.
And realize that they can dream big and be whatever they want to be. And our 5th graders got a tour of the high school, so they were so excited to go to the high school and see what's going to be their future.
It just warmed my heart to know that this tradition has been kept alive. I know that my principal at the time, Dr. Ruth Ann Reynolds, bless her heart, she's no longer with us, but she's the one that allowed me to take the reins and do this and to keep this going. And I'm so excited to see that the administration continues to see how important and vital this is.
We have parents that have done the walk when they were students, and now their own children are doing the walk. We have many Hillsborough High School students that came up to us today and said, I did the walk when I was at Seminole Heights Elementary, and that's why I came to Hillsborough High School. And so we're building graduates every time we
The board workshop for June 25th, 2024 will now begin. And it's on exceptional student education.
So, yeah, thank you, Madam Chair. So, board members, first off, thank you for the time this morning. I really wanted to have an opportunity for our ESC staff. We have a new leader for ESC, Shannon Lesperance. So we really wanted to take some time this morning to kind of give an overview of our Exceptional Student Education Department, the work that they do. So really appreciate this time to do so. I'm going to go ahead and turn it over to Ms. Brown to kind of give us an overview and then move into the workshop. I do ask, we do have a presentation, so the first 20, 30 minutes, if we could just kind of hear the presentation for ESC, and then we'll have any time for question if that's okay. So without further ado, Ms. Brown.
Thank you, Mr. Superintendent.
Okay.
And if anyone who wants to get in the queue, let member Vaughn know, and she'll take your name and place you in the queue.
Thank you. This is a wonderful opportunity for us, and we've been really excited about being able to come to you this morning with some information. The information you'll receive today is absolutely at probably the highest level that we can provide you right now, but the focus is going to be on compliance. The compliance piece is a piece that the law requires us to do, so it's important for us to start there. So as we go through the presentation, we will have members of the staff that will be speaking to you, and we actually have some members of staff in the audience to assist with any questions that you might have at the end. So I have with me the new, not so new, because she's done amazing things over the course of the short time that she's been in the role, which was November, Shannon Lesperance, who has over 30 years experience in exceptional student education and has been able to do some really good things really quickly, some things that were necessary. And two of the important things that she did was hire 2 assistant directors, one for compliance and staffing, who's Ms. Kim Loy, and one for programs and equity, and that is Ms. Shelley Sadola Hayes. The 3 of them will assist this morning along with members of our audience to kind of help us along. I will tell you one of the things that that I can't go without saying is how complex student education really is. And as we do the work of working with our students with disabilities, we want to be intentional, we want to be thoughtful, and we want to ensure that the students' needs are being met. We are required to do that, but beyond being required to do that, I can tell you each member here has a heart for doing that, for doing the right thing for kids. So I'm not going to take any more of your time, and just I want to thank you again for allowing us this opportunity, and also for the support that you show, not only for staff, but more importantly for the support that you show for our students with disabilities. So with that, I'm going to give it to Ms. Lesperance so that we can begin our presentation.
I just want to let everyone know that member Rendon is on Teams as well.
Okay, good morning, everyone. Thank you so much for this opportunity to provide this high-level overview of exceptional student education. So the first thing I just want to we'll get on our way. So in your binder, we did provide you with a book, A School Board Member's Guide to Special Education from the Council of Exceptional Children. And so this is a really great resource for you all that outlines all of the laws that we are governed by in exceptional student education. In your binder, you have a copy of the PowerPoint. And then in the very first tab, you will have our annual performance report. So this is kind of like our ESE report card. This is how the state monitors us. As we talk about different indicators that are on here, I will refer back to it. You will notice that the years for each indicator could be different. So when you're looking at these indicators, make sure you look at the year in which the data is being collected. And then if you look at that very first one, graduation rate, I want to point out 2 things. One, this is not the cohort data that you're used to seeing about graduation rate. This is just, in general, students with disabilities, when they graduate, what % graduate with a standard diploma. And the target that is on here is actually being corrected. In the state strategic plan, the data that is posted is 82% for this particular year of 122. So we did meet with the bureau chief recently about this error, and so they are looking into that. So we should have met that and exceeded that target. Okay, behind that, you will see child find information and we're going to talk about child find and our obligation as a district, but these are resources that are available that we give to our families, to our community members, and other stakeholders. So those are just some artifacts for you. Our evaluation, you're going to see two different handouts. One is the 30-60 day rule, which we are going to talk about more specifically in the presentation. But behind that, there's a PowerPoint specifically on FAPE, Free Appropriate Public Education. We could spend this whole day just talking about FAPE. It's very complex. This is actual presentation that we have done for a school-based team. So as we talk about it, if you have further information that you might want to look into, this is a great resource for you. Under related services, you're going to see our occupational therapy, physical therapy, speech, language, specialized transportation, just some frequently asked questions and more information about those related services should you have questions about that. Under transition, we are going to highlight some of our transition programs today. We're very proud of all the transition programs that we have in Hillsborough County Public Schools, but this will give you more in-depth information on all of the programs that we have operating here now. Behind that, you have the procedural safeguards. These are our rights for our parents and students with disabilities. We are required to go over these and provide them to families every time we meet to talk about their students. That is fun reading if you would like to partake in that at nighttime. Dispute resolution. So part of our responsibility is to help parents with dispute resolution. So there's many different avenues that parents can, if they disagree with us or we disagree with them, that we can take. We're going to talk about those different avenues, but it is our responsibility to make sure that we help parents with understanding their rights, and if they don't agree to us, what dispute resolution practices they can participate in. The next tab is the difference between ADA, IDA, and 504. So we'll kind of highlight the differences through the presentation, but this will give you even more information should you be interested in that. And then private instructional personnel is a state statute that we're going to actually highlight today because of its importance to our community, our parents, and our school-based administrators. And then at the end, there will be two handouts. One just highlighting all the summer trainings that we're doing around exceptional student education, and then also a contact list of all of our, us here, but also our supervisors and what they oversee in case you get any questions and you want to reach out to any one of us to provide that help. I did miss one tab actually called student demographics. We're going to talk about the demographics in Hillsborough, but there are two additional handouts in here highlighting our deaf and hard of hearing program and our vision impaired program, because we do have very awesome programs in Hillsborough, some of the best in the state. Okay, so let's go deep dive into the presentation. So by the end of this workshop, these are some things that we hope, I guess I have to do that. Maybe. Okay, great. Okay, well, the workshop overview, you can follow along in the handout at least. We are hoping by the end of this workshop that you will have a better understanding of the following topics. So understanding special education, the laws and the basics that we have to abide by, student discipline, assessment, grades and graduation, and dispute resolution for students with disabilities. So this shows our demographics. So we serve 35,599 students with IEPs. So this demographic that you're looking at is broken up by primary exceptionality. So when we report data to the state, it's by what your primary exceptionality is. That doesn't mean that you're not eligible for more than one of exceptionality, but this is going to show you by the primary how many students we have and what percentage. So obviously the largest is our SLD students, and then I think followed by that are students with autism. But again, you could have a primary disability of, say, intellectual disability, but also have an eligibility of autism. That number would not be included here. So if we go to the next slide, this is going to talk about funding and how we are funded by the federal, by our federal grants and by our weighted funding from the state. So the Office of Special Education Programs, OSEP, administers 3 formula grants authorized by the Individuals with Disabilities Act, and these 3 grants are federal grants that provide above and beyond support to students for services that are above and beyond what all students are entitled to. So for the Part B formula grants, that serves ages 3 to 21, and that's supplemental to our state and local funding. For this past year, that grant was equivalent to $50 million. And then you have to realize within that $50 million, there are certain things that you have to do. So there's a proportionate share that goes to private schools, which equals close to $1 million. We have to do a proportionate share to charter schools or provide services. They have the choice to take their funds or take the services that we provide. So that was about $531,000 that we paid out to charter schools. And then we have a 15% set aside for Coordinated Comprehensive Early Intervening Services, or CCEIS, you may have heard it called. That is for disproportionate discipline. It is an indicator on our performance plan, and so we specifically are being monitored for suspending Black students with disabilities out of school for more than 10 days, and that equates to about $7 million. Then we have the preschool grant. So part of that, so you have the 3 to 21, and then you have the 3 to 5, and that we get about $980,000 for that grant. We also have a proportionate share that goes to private schools out of that. And then the Part C is like our birth to 3-year-olds, which is like our early steps. But in Hillsborough, we actually provide services to birth to 3-year-old students who are deaf at their homes and in the community. So we also are very proud of that program. In addition to that federal money, of course, we get state and district money, and we have what's called weighted funding. So when a student has an IEP, at the end of that IEP, we fill out a funding document documenting all of the services that we provide, and then the state provides us weighted funding depending. The more services, the more money that the student, that we receive for that student. So going on to the structure of support, this is one of the things since I've been here, we have a reorganization to really become specialists and experts in our field. You're going to see today that you cannot know everything there is to know about ESE, even though I will need to know. But not everyone can be an expert in everything. I can't be an expert in everything. So we've divided our division or our department into 3 sections. We have Shelley's section, which is Instructional Programs and Equity. So she oversees all of our program staff, speech and language, our instructional K-12 reading and math, ELA. She has related services, transition. And then we have Kim Loy, who does the compliance. So our compliance, our staffing specialists and coordinators, they need to be our experts in compliance, and our program people need to be the program experts. So we have people to go to that know all the things. Then we have our regional staff. We have an ESE supervisor and a district resource teacher in each of the regions. We have 7 regions, and we've aligned ourselves this year coming up with the regional superintendents to be grade bands so that every school has a team of support. So they have a regional superintendent, they have a supervisor and a DRT, and those supervisors and DRTs, their specialty should be on instruction and behavior. Right, so they're going to make sure that our teachers are equipped with what they need to deliver specially designed instruction to help with behavior and implement the IEPs that Kim's team is so graciously going to teach us how to make sure that we have the best IEPs ever. So that's how our organizational chart is set up moving forward as of July 1st. So just quickly to go over the process, how do you even become a student with a disability? This is also very complex. I'm going to give you the cliff notes of that. But once someone has identified a need, that could be a parent, it could be a community member, it could be a physician, it could be a teacher, it could be anyone. Once they've identified a need, then the school team comes together and they look at, do we need a referral? Once a referral is written, then we get permission from the family, we do an evaluation, we come to an eligibility, determine if the student is eligible or not. If they are, we write an IEP. Then we decide their placement, we collect data on the instruction, and then we come back every year and make sure that we are addressing that IEP. So child find. Every district has a child find obligation. This means our job, everyone in the district, is to find and assist those students who may have a disability. And that is from birth to 2022 in Hillsborough and 21 according to our statutes. So Hillsborough County is committed to ensuring that any student who is at risk, that we're finding them, that we're evaluating them, and we're getting them services. On the next slide, it talks specifically about Fiddlers, our Florida Diagnostic and Learning Resource systems. Our Child Find teams are collaborative with Fiddlers, and so those teams are responsible for working with many Hillsborough County partners, including the Early Childhood Council, Early Learning Coalition, and Early Steps. Those are the Florida's Birth to 3 service providers, and making sure that we get kids staffed into our schools if they need it by their 3rd birthday, and that's also one of our indicators, which we hit 100% every year, so we're really proud of that. As of today, those Child Find teams have completed 1,580 screenings, 2,068 referrals, 1,527 evaluations, and 1,664 eligibilities, and these are just for our preschool students. And then at the last school board meeting, if you remember, we brought an item about working with the school readiness and that they provide funds to fund 3 employees in this Child Find team. So I have some data around that because I know Ms. Vaughn had asked us about that. Those 3 people that are funded by the Early Learning Coalition, we've done 172 referrals from the Early Learning Coalition, which resulted in 147 evaluation conducted by these 3 employees. And that's what we have for as of right now for this school year of what we've done with those 3 folks. Okay, so evaluations. So this is indicator 11, actually, in our annual performance plan. And what they're measuring us on is, do we evaluate people in a timely manner? If it's an initial eval, we have to have it done within 60 calendar days. So if you wanted to look at that chart in your evaluation tab, it will give you very specifically, once the student enrolls in kindergarten or higher, if someone suspects a student has a disability, then the school has to meet within 30 calendar days as a child study team to address the concern. And so they may or may not initiate an evaluation, but that's where that process starts. Once they do initiate that evaluation, we have 60 calendar days to get the evaluation completed. So you often probably hear things about the 30, 60-day rules. That's what they are. And now you'll have a little cheat sheet in case you're ever asked about that. So eligibility. This is often confusing for people because we think that just because you have a diagnosis of something, you should be eligible for an IEP, and that doesn't always equate to that. So there's 2 components that are required for eligibility. One, you must have a disability, one of those 13 IDEA disability categories that you saw in our demographic chart, based on a comprehensive evaluation. So you meet criteria for one of those, but then you also have to demonstrate the need for special education services. So you could have someone that has a diagnosis of, say, autism or something else, but they don't necessarily have the need for specially designed instruction. So they might not be eligible for an IEP, but then they might be eligible for a 504 plan because maybe what they need is accommodations or access to something, or maybe they just need response to intervention. So that eligibility piece can be a little complicated for parents and others because you have to have both components to be considered eligible for special education. Once you've been eligible, then you're going to go to that team to write an IEP, and the problem-solving process is really important that that team looks at what are the student's strengths and weaknesses. They identify those in the present level. Then they write specific goals for that student in those areas. We provide specially designed instruction around those goals, and we collect data and report that out to the parents on a regular basis. So special education. So this is another thing that can be very complicated and confusing. Special education is a service, right? It's something we provide, but it doesn't necessarily mean it has to be in a certain spot. In this room over here, as Kim likes to say, the room down the hall, right? It doesn't have to be the room down the hall. It can be in a gen ed room. Maybe it isn't the room down the hall. Maybe it's in a separate school. But that specially designed instruction piece is very explicit, systematic, and multi-sensory approach, and it should be based on the student need. So if I'm going into a co-teach ELA class and my student has a reading goal, then I should be layering on top of whatever the gen ed teacher is doing to provide that tiered instruction that's specific to that student. And just to give you a little continuum, as the more significant the disability, the more intensive that specially designed instruction should be. And as the student progresses and needs less, then it kind of goes the opposite way, right? You start pulling back. So it doesn't, the type and intensity of the intervention doesn't equate to a place either. So this is what sometimes we think, oh, if you're a more significant student and you need more assistance, that you should be in a special class or a resource room. That is not necessarily the case. So in addition to special ed services, a student might require related services to benefit from their special ed program, and here is a list of some of those. So one example is like specialized transportation. Some of our students with disabilities cannot access the regular transportation or bus, and so without specialized, they wouldn't be able to access school. So that's a related service. It's a service that's related to what the disability that they have. Other related services here are speech and language, occupational and physical therapy, and counseling. And not all of these come with an eligibility. It could be that it's just related to your disability and you require it and you receive that. So LRE, least restrictive environment. So the IDA requires students with disabilities to be educated with their non-disabled peers to the maximum extent possible, meaning you've exhausted everything you can in that gen ed class before you consider another placement. And placement decisions have to be based on the student needs, and they're identified in the student's IEP. So transition. Transition, we have a statute that requires our IEP teams to start the transition process during the student's 7th grade year or when the student attains the age of 12, whichever is first. And in that IEP, transition services have to be identified. So these services are required based on the individual needs of the student, taking into account their strengths, their preferences, and interests. And the transition services included would be the things you see listed here: instruction, related services, community services, etc. So we were going to highlight some of our transition programs. We have a lot of them. I'm not going to talk about all of them, but I will highlight just a few on the next few slides. We have what's called 12 plus. So we have 25 schools with 29 programs, and these are for students who have deferred. And we're going to talk about deferral, but I'll just tell you what it means now. It's basically the student has met the graduation requirements, but they are able to defer and continue services as long as they meet the criteria. And one of the criteria is that they're enrolled in one of these 12 plus programs. So this assists our young adults in gaining pre-employment skills. It develops the necessary skills to be successful parts of their community. Creating how our independents can excel, that's choice. In our GMAC programs, we have 10 schools. Also, these programs are for students who have deferred. We have community-based training and community work exposure. So we have 24 schools who have CBT. That's for 11th and 12th graders. And then our CWE, we have 9 schools that have that, and that's for students who have deferred. And they go out into the community. You may see them here at ROSAC. We have some kids that come here and participate. They come to Velasco. They get to experience different jobs. And it's a really great, it's so fun to have them. I mean, I love having them at Velasco. We have Harmony House. So if you've never been to Harmony House, I definitely encourage you to take a visit. It's like a set, it's a portable, but it's set up like your house. And the kids go, and I think they go for a week, right? They go a week. 4 days, and then they experience like all the things you have to do to on your own, right? You have to be able to cook, you have to be able to make your bed and clean and all those things, and it's just a great experience. We had 31 schools participate. Grades 9 and 10 went this year. And then Project Quest, also fantastic. We just visited and saw the culminating project for these kids. These are kids that have disabilities, but they go to HCC and they participate in earning 2 college courses in the summer. They go for 3 weeks, I think, and they earn two classes. And then we got to go see the work that they did, because they were learning how to create a video and to be media. So like some of them were the reporters and some of them did the camera. It was fantastic. We had 21 students go to our Ybor campus and 24 go to South Shore, and those students were represented throughout 22 different schools that sent kids, and we send a transition specialist to go and co-teach with the professor so they have the support they need during that time. It's fabulous. So there's a whole nother slide on additional programs. I'll let you read those on your own. You also have the tab with details on those, but I think we do a fantastic job with our transition program. So graduation and deferral, I already explained to you what deferral is, but we do have transition specialists. We have them. They support the schools to ensure that our kids graduate. They check their credits. They make sure they have the GPA they need. If they need a waiver, make sure that those are completed. So students with disabilities who may earn a certificate of completion for one reason or another, they're allowed to stay with us through their 22nd birthday to get credits and whatever they need to make sure that they graduate. For transition indicators, those are on that annual performance plan for 13 and 14. 13 is really about do we address their transition needs and their ideas. As you can see, we meet that at 100%. We do a there, and then post-secondary outcomes, we exceeded the target on 3. The one that we didn't, we're pretty close, but that one is for enrolling in higher ed. So we're responsible for collecting data once the kids leave us. We have to find out how many went to higher education, how many got employed, how many went to another program to support in independent living. And you can see that like 14C, we had 74.7% of our who are no longer with us that are either enrolled in higher, some other post-secondary ed program, competitive employed, or other employment within a year of us. So we're doing a there. The procedural safeguards, I provided with all of them in tense, but these are the areas that our parents and students have protections in, and we are required to provide them before and during every single time we meet with them, and we explain them to the parents, and so that they know their rights as a student of a parent who has a student with a disability. So dispute resolution, nobody ever wants to be in dispute resolution, but there are lots of options to resolve it when we are there. And it's our job, like I said, to make sure parents understand their rights when it comes to those, and that we don't discourage them from participating in those, because oftentimes we're able to come to a resolution. So you can see that there are formal dispute resolution processes here, mediation, state complaints, due process, resolution meetings. And so just to give you a little data around our dispute resolution, we had 25 due process complaints filed, but we were able to resolve 23 of the 25 at the local level. We had 13 state complaints. Only 3 went to the state to be investigated. 10 were resolved at the local level. We had 7 mediations, and 1 was later withdrawn, and all others were resolved. And mediation is really, it's a positive experience, I think, for both us and the family, because we can get a lot resolved in mediation. And so if we can solve it there, we definitely want to. So we voluntarily participate in mediation anytime we can. The next slide just talks about all of these laws serve a distinct purpose in serving individuals with disability, with ADA being the large umbrella, and then 504, they are students with disabilities who might require, remember, that special education component, but do require access and accommodations, and of course the IEP for those students who do meet that eligibility criteria. Okay, private instructional personnel. So this is a state statute, and we have many statutes that we have to implement in the school district and in the state of Florida, right? But we've chosen to highlight this one because it is very important to our parents and to our school personnel. So what this statute says is that if a parent has a private provider, it could be a speech therapist, an occupational therapist, a registered behavior tech. There's a list of the ones that are approved. If they have one that they are using in the home or in the community, we must collaborate with them, allow them to observe and serve students in our school. There are 2 rules about that. 1, they of course have to meet the screening requirements. They have to be certified, they have to have a license, they have to be Jessica Lunsford Act, they have to, all of that. And then the other component is when they sit down with the school to do the collaboration meeting, the principal and the public instructional personnel, which is usually a teacher, therapist, have the final say in the when and where. And again, this is a service that's available to parents who have private providers. It's not necessarily related to, if we say the student needs something, it has to be in the. So it's not necessarily something we've said they need. It's something that the parent has access to, and we are asked to collaborate and work with them in our school. If you look behind that tab, you will see that there is, so we have the statute, but then we have a procedure on how to implement that statute. It is instructional personnel. I tell you what color, but it's probably a different color on yours than it is mine. It is second to the last. This kind of goes over what the state statute said. And then there's a parent participation packet. So the parent basically fills out this packet that says, I want my speech therapist to come to school and do therapy with my student. So we have, and then the private instructional person also has to agree to not disrupt the classroom, interfere with instruction, not talk to other children in the room, all of those kinds of things. They have to agree. Then the school sits down and has a collaboration meeting, and they talk about the needs, what the parent is asking for, and then they come up with a plan when that provider is going to come and deliver the service, if they're coming to observe. It could be a variety of different things. So we, when this came out, we went to our surrounding districts and also collaborated with them, because we share a lot of students with Pasco, Pinellas, Pope, right? And so when our kids move around, and then we share providers too. So providers will say, well, they do it like this in Pasco, or they do it like this in Pinellas. It was actually a state work group of districts that got together to be more alike in their procedure and different. You have to follow the statute. The statute says you have to do these, but the when and where is what we have to decide as a team. And so our pretty closely aligned with everybody else's, so that when parents or providers move from place to place, we are more alike than different. So the last thing is just, what is our focus for moving forward? Kind of hit on that when I talked about, we really want to be honing in on our expertise. We need to have people who are generalist, because the better experts we are, we have experts for our teachers, for our principals, for our parents and students. So our focus is the compliance, right? So Kim has a whole outline of what she's going to train our staffing specialists in to be the best they can be around compliance, and they will also train our school personnel. And then we have specially designed instruction, making sure our teachers have research-based materials, they know how to implement that they're doing it with fidelity, so that we can get our reading and math scores up and close that gap for our students. And then behavior, because if we don't have an emphasis on behavior, kids cannot learn, right? So we have to do that. And then we also want to better our partnerships with our parents. And so we have a lot of training for parents, but we're going to increase our parent training and really offer some advocacy training for parents, because parents are advocates for their students, and we should be helping them to advocate and not feel like we're on the other side, right? We need to be working with them. So those are our areas of focus for school year. And so that is it. Now you can ask all the questions you want. That's it. How'd I do? Are we in the... Yeah. 36 minutes.
Thank you very much. Member Gray, you're the first one in the queue.
Well, first off, thank you so much, Ms. Lesperance. Lesperance. I think that's French, right?
Yes, well, I inherited that name. I married into it, but I was a Leclerc, so I guess I still was French.
Well, and a big thank you to Kim Loy and Ms. Hayes. A lot of work you've done. And my question, the initial question I have, and this came from years ago, but I just had a little bit of time to look at the Florida statute, which you mentioned, and that's 1003.57, and I talked to you yesterday. Mm-hmm. So I dug into that, and then in the words that have in our policy may or may not include the word inclusion, which this has to say, according to what I'm reading here, that those certain words, vocabulary, should be put into our school district. So then I looked at our policies, and this is just a observation. I am not an expert by any means, so I will want your feedback. But when we have a policy, for example, 2260.01, and the word inclusion is not mentioned in that particular policy, and then I have the other policies, I was just wondering if your comment would be, when you make a comment, if you can just explain why our policy doesn't have the word. It says a school district shall use the term inclusion to mean that a student is receiving education in a general education class setting. And mind you, I see such compliance, so many parallels with what the statutes are saying and the laws with what you're sharing. So, I mean, I'm kind of being a little bit picky, perhaps. Can you just share?
So is your question, why do we not use the word inclusion in our policy, but it's written where?
It's
in the PIP?
1003.57, exceptional students instruction. A school district shall use the term inclusion. And this is under those phrases that we're supposed to use. For example, what you just said, exceptional student education center or special day school. So there's certain words that this statute says that we should be using, and I was just curious because I have, anyway, Ms. Roy? Lloyd.
Thank you.
Sorry.
I don't see the statute in front of me, but I think because the private instructional personnel or collaboration of public and private is 1003.572. We may be looking at two different ones, but what I think you're referring to is several years ago that in statute they put the definition that we would use of inclusion in our state. I don't know that that's in our exceptional student education school board policy anywhere, as you are pointing out. But I know that statute defined what a special day school would be, what inclusion, if that's the one you're speaking of.
Yeah.
And we can certainly look at that because I know those are defined terms that we are to use and make an understanding of them.
Yeah, that was a big to-do years ago, maybe even more than a decade ago, about inclusion. Tracy, I'm sure you remember that. So, and I only bring it up because that was very much showcased in the vocabulary of many of the specialists, and I think most of you probably realize that. So I would like that to be looked into. Probably not a hard edit to make because I see, an equivalent statement of providing for the education of each qualified person with a disability. It's a sentence that could easily be, and I'll just give this to you because that way, you don't have to redo anything. And here's the Florida statute. It's also on another policy that's missing the word, and I'm going to give you this too because, policy 2623, student education. So let's just give that. The other question I have, and I know there's many questions everyone has, is the Kelly subs. We know that we're being dominated by subs in many ways, whether we like it or not, right? Teacher shortage. But it really, the notion that we are having a Dr. Patton who is trying her best to recruit teachers, we have such a shortage of ESE teachers, and you're layering it with the challenge of expert ESE for compliance, legality, and that's another whole subject. So what are we doing to gain, specifically, what is our plan of recruitment to gain these experts, the ESE teachers? Do we have any feedback on that?
So I'm sure Dr. Patton would like to also comment, but I will just say that we've been working closely with Dr. Patton and her team to really have a recruiting effort around exceptional student education teachers and paras, speech language pathologists, vision teachers, all the things, right? It is a critical shortage area. But to address your, and we did provide one of our ESE personnel now works in the office with Dr. Patton to help with those, bridging the gaps between the HR partners and our schools and looking at critical shortages and making sure that those schools get priority when it comes to interviewing applicants. But as far as the subs, I do want to talk about that because we recently had this situation with a sub. So if you have a long-term sub who's not ESE certified, what do you do? Because it does impact our students, right? So we, some of the things that we do are we make sure that the certified teacher on campus or the ESE specialist is overseeing that substitute. They are writing lesson plans with them. They are observing them. They're making sure that they implement the practices. We send them through the same trainings that we would our ESE teachers to help make sure that our students are getting the services that they need, even if they have a substitute. So I think turn it over to you.
Good morning.
Good morning. Just to add on to what Shannon was saying, we do have a very aggressive plan when it comes to ESE specialized. We shared that recruitment strategy when we provided that information to the board. And part of our goal is to make sure that, again, we're not only focusing on not just utilizing subs, but finding qualified individuals that want to come permanently and work with us permanently. So in our collaboration with Deborah Mitchell, which is our HR liaison that we have, we daily sit down and talk about it, have regular meetings to say what's the status of it. And I've just asked her to give me the most recent update of how many hires we've had, because it's helped us now bridge the gap of not just having individuals apply for positions and us not knowing that they're sitting there waiting, particularly certified, but that we pull them out and make a special attention towards saying this is a key area that we call critical, and we want to make sure that we are taking a very aggressive stance towards filling all those positions and staying connected very closely with the principals, because that's what's important, is that the principals know the positions are there and the individuals available and getting the interviews done. So we're scheduling those and moving forward. So if you'll give me a few moments, she's gathering that data right now to give you more clear numbers as to what we've hired recently and where we are in that process, because we know that it's something that's top of mind for everyone.
Well, there's such a liability part of this compliance. It's very scary if you really dig into it.
Right.
So,
ma'am, I just want to add, it's important to note that this is not in place of what HR does for every other school. They treat ESC the way they treat all schools. This is supplemental, which is on top of all the work that HR is doing. We're able to do a little bit more because of how important this is for us to be able to hire certified teachers. So I just wanted to state that it's on top of what HR does.
Well, thank you for that comment. And also, one other question. When we talk about the weighted FTE versus unweighted, right? So it may be helpful to explain, and you did yesterday, Shannon, that the correlation between the high needs ESE student, I think you rated 4 to 5, versus the lower 1 to 3. Can you share that type of revenue stream?
Absolutely. So our students, if they have a matrix of 1 to 3, we get funding called the ESE guarantee, right? It's a set amount that that is generated for those students. The higher needs, the higher the matrix. So if you have a level 4, there's 5 domains on the matrix. So if you get a level 4, then you need a lot of service, right? But those services cost more money. So the state is going to provide additional weighted funding for those level 4s, because you probably have a speech therapist working with you. You may have a smaller classroom. You might need a para. And then level 5 is like your really intensive student. That doesn't mean you're necessarily in an ESE center, but our ESE centers, almost all the students there are 4s and 5s, and then we still have 4s and 5s within our schools as well, but they get even additional funding. So that weighted funding depends on the needs of the student, and those matrix are done, if they're 4s and 5s, they have to be done every year. They can be done more frequently.
Okay, thank you. Thank you. And I appreciate everything that you're all doing. Thank you, Dr. Patton.
Thank you, Member Gray. I have a few questions. I just want to kind of make sure I'm understanding some of the information right, and then I have some questions. So on slide 3, when we show the percentage here, now I know our numbers change of students. At one point it was 220,000. I think last time I met with Ms. Johnson, she was expecting closer to 185,000 students. But based on those numbers, is this to say that anywhere from 5 to 6% of our students are identified as ESE or having a disability based on these statistics?
So the percent enrolled of students that have IEPs is closer to 15%, which is really in line with the national average. Yep. It's like 14.9, yes.
But that number doesn't match the number of students that we have enrolled based on this slide, does it?
Out of all of our students, so 35,599 out of the however many we have enrolled this number should be close to 15%.
Okay. I'll do my math again. I don't think it was, but I'll
so remember the percentage is during FTE, so whatever we reported during FTE.
Okay, thanks. Now I know that you also said on slide 3, and you mentioned that we provide some services to private schools, right? And that some of the funding is earmarked for that.
Yes.
So I guess my question is, I know that there's a lot of student services that are providing right now a lot of evaluations for private schools. So they're under the impression that we're not getting the revenue or paid for that. But based on this slide, it sounds like the private school gets it and then they give it back to us, or are we providing services for the private schools that we're not getting reimbursed for?
So we can't give money directly to the private schools. So what we do is there's a consultation meeting that occurs around October. All the not-for-profit private schools are invited to that meeting to decide what services we're going to provide using that proportionate share. And so right now during that consultation, it was decided that we would provide speech and language services. We contract that from, I believe it used to be Beth Ingram, but now it is Health Pro, thank you. Health Pro, and then we have 2 district resource teachers who hold all those service plan meetings. So the money is spent on services, not directly to the school. Go ahead.
So if there's our staff, other than the 2 who are spending a lot of time doing the evaluation process.
Are you talking about psychological evaluations?
No.
Or
I'm
any
talking
kind
about
of evaluation?
evaluations.
So that's different than this. There has to be sent on services.
Okay.
In addition, the child find, when we talked about child find, we're obligated to do child find for any student, including private schools. So if you're at a private school and the private school personnel identify you as being a suspect of having a disability, or the parent does, then they have the right to go to their neighborhood schools and ask for an evaluation. Those are the ones you're referring to that would be considered non-funded, because we don't collect FTE on those private school students, but we are required to do their evaluations. And if they have the empowerment scholarship, they have even different rules for those specific students. We have to do their evaluations within 30 days, start to finish.
Okay, that helps.
They exceed the rule that we have, the 60-day. Yeah.
I appreciate that. And then I know on slide, I didn't write the slide down here, where we were talking about the timeline, the 30/60. What is the penalty for not meeting that timeline?
So we are, it's one of our indicators, indicator 11. So the penalty that goes along with that is that we get state monitoring, and it could result in a financial penalty if it continues over so much time. So the state is actually coming out with a new way to monitor us. You will see this annual performance review. That will be just one part of our monitoring. There'll also be a risk assessment now associated with that, which Title I has already been using a tool similar. And so when we'll get a score based on those 2 things, and depending what the score is, the monitoring is different. So it's more intense monitoring. We'll have to do more training, and it could be a financial penalty if it occurs over a series of years.
And then on the same kind of spectrum, if there are teachers who are not implementing IEPs or 504s or following that, where's the accountability piece in that? How are we making sure that our staff is accountable for those IEPs or 504s or whichever educational plan the student has?
So I would say that would be part of their evaluation at their school with their school principal. If they're not implementing, they're required to implement all of those things, 504 accommodations, IEP services, accommodations, all the things. If they're not, then that should be part of their evaluation. Now, if it's a training issue, like we have a lot of new folks,
Sure.
then that would be our responsibility to make sure that they are well trained. And IEP training is one of the required. We don't have a lot of required trainings, but that is one for any new teacher. So we either provide a sub so they can come, or we pay them to come, but they are required to come to IEP training.
So may I also add, I'm sorry,
Sure.
I think it's important to note also that our students with disabilities are gen ed students first. And so the responsibility for their performance, the responsibility for ensuring that they get what they need, what they're required to get, begins with school-based leadership. It is the school's responsibility to ensure. This team is responsible for supporting that and providing the training, providing the other additional supports that are needed. But I think it's important to note the responsibility that exists for these students with their gen ed classroom and with their principals of any school that they're in. I just think that's important to note.
Okay, thank you. Now, I know that another piece of what the presentation said was that we kind of check with other counties and align our practices to mirror theirs in some ways, to have best practices. So if students go to other counties, there's some continuity between the different counties. Is that true with our SLD process?
So no, not necessarily. So the eligibility around SLD could look different. The basic requirements, right, that we're all required to do, but how we get there could be different in surrounding counties.
Okay. And is there anything specifically that we do differently than our surrounding counties that you know of offhand?
I
I think what could look different is there's a form that we use. It is required component of the eligibility process that's called a written summary of group analysis of data, long title. But because our state went to that we could use the results of response to intervention as part of eligibility criteria. Before it was our students in almost every eligibility are required to get gen ed intervention prior to us thinking about that they might be a student with a disability. There's a few exceptions. But for specific learning disabilities, it is that you can use that criteria as part of the eligibility. It's a required component of eligibility. So you have to have that in place to have the pieces. The group analysis sheet a district can create, but it requires us to compare that student's response to intervention to their peers, to norms, state norms, so that you're looking at what that tiered instruction in that school is also going on, and that you're weeding out that the student, because you have to do some of those exclusion pieces. Did the student get good instruction? Did they get targeted intervention with fidelity? To make sure that we're really looking at a student with a disability, a learning disability at the end. So what you could see is we all have the required components. State statute says these are the pieces we must have. It's spelled out for us. That form could look different in the way that they gather and do the analysis on that.
Okay, I appreciate it. I'd like to learn more about that specifically outside of this. And then I know that we were talking about behavior as one of the qualities that we're going to look at, strengthening our focuses that we're going to have going into this next year. Along that line, can you help me understand the difference between approaching behavior with our EDB students, what that looks like, how we're working on staffing for that, what the classroom environment looks like? Because, I think, and I could be wrong, and you're the experts, right, that there should be a differentiated approach to behavior based on, if someone's on the spectrum or they're EDB, as opposed to, a single approach to behavior issues. So I'd like to know what that's going to look like, the differentiation, and I am hearing concerns about our EDB classrooms as far as getting the appropriate staff and making sure that we're hitting instructional goals with that. So I'd love to know some feedback on EDB specifically.
Okay, so a couple of years ago, we looked at our behavior support programs, because if you required a special class for behavior supports, it didn't necessarily matter what your eligibility was, what your symptoms were, you were together in this class. A couple of years ago, we dismantled that, and we started identifying the students by more specific needs. So a student with autism who has behavior looks very different from a student with who is EBD, and so the approach is different. So we started separating those out. We have very separate trainings for those teachers who work with those students. And then in addition to that, in the past we have been very reactive to behavior. Our BCBAs, or our board certified behavior analysts, kind of come in at the end, right, when things are really tough. So we're reversing that, and we're going to start having our BCBAs be in the front end to really get some strategies in place early on, especially in our EPD classrooms, to make sure that those students are set up for success, and we're not waiting until it's so bad that now we're bringing in, the BCBA. And Shelley can probably highlight other things that we are going to implement next year under her leadership about this, because we've had much discussion about it.
Yes. Well, I happen to be
Yeah.
Okay. So I happen to be a former EBD teacher, old language EH. I'm 34 years in the district. So Dr. Koshi, who previously served as our ASD IND supervisor, is also taking on the behavior component. Oftentimes, categorically, different needs. We partner with the acute care providers. We are structuring and currently structuring. Dr. Koshi's coming back from vacation and has a long list on her desk that we'll talk about later, where we set up a partnership with the region teams so that they are able to, we can problem solve site support. So our region teams go into the sites and look at I just came from a region, Region 2, and so we have those monthly triages where we speak. One time you observed me triaging at Alexander, where we bring all of the providers to the school so that we can problem solve around the student. If they reach a tertiary level of need, we then bring it to the district team to include the mental health component, student services component, our acute care providers, SEDNet, so that we have a comprehensive wraparound team. BCBAs sit on that team. So we're restructuring to include the ICI project, CARD, Center for Autism and Related Disabilities, SEDNet, which is our network agency, and it is a grant-funded discretionary grant, where we sit together and look at the individual needs of the student and then bring in the wraparound piece to guide and help our families secure those services that they need. So those are monthly meetings as well. So we have many things. We have school services where we've differentiated the program supports, the curriculum, the materials, and the trainings. We then have site support where the region teams go and support the schools monthly, especially those sites that have full-time programs, whether that's pre-K, ASD, IND, access units, separate class units for behavior, whether it's ASD or EBD. And then we have the district team that is made up of community resources and programs within and divisions within our department. So we can except maybe at that time what we're doing, so then we come back together. Or let me use another example. We partner with many children's board crisis. If a student, I'll use an example. If a student is Baker acted, then the parent must sign a release to allow us to further support. If they do not sign a release, then the social work team cannot come back and mental health team cannot come back and provide services. However, if they do, we immediately convene. So we are partnering with Toby and his team and the MTSS teams, the mental health teams. We meet, they are meeting monthly to discuss restraint seclusion data. So we do have statute around that. And so if a student continues to show those needs, we're reviewing that information so that we can determine through the FBA or PBIP, those positive behavior intervention plans, what else can we do? What else can we layer on? And what, do we need to continue to investigate, right? Each of our BCBAs have a different focus or lens that they bring to that team. So you have some that have clinical experience, you have some that have a strong mental health experience, you have some that have worked in residential facilities, and so it's bringing that whole picture to that team. So we are tiered in our level of support, just like any MTSS piece would be around behavior.
Thank you. I appreciate it. I have more questions about EDB specifically, but I'm going to allow other members to speak, and I can meet with you afterwards.
Mm-hmm. Yes. Okay.
The next in the queue is Chair Perez.
Thank you. I've been looking forward to this presentation, actually. So I'm going to start off with this. The work for the students is best known by their parents, especially the special needs. And one piece that continued to be missed during this presentation was the inclusion of the parent as a member of the team. You did mention it, however, when you needed them to sign for a Baker Act, and you mentioned them, of course, at the end, and I think it was in 20, in the parent, procedural safeguards, when it came to number 2 for parent participation. We're going to go through this for a moment. The demographics here is we have 35,599 students with IEPs. From what I hear as a board member for the last 6 years is that sometimes it takes 3 to 5 years for an IEP or 504 to be completed in this district. Why does it take that long for this district to complete an IEP or 504? When we're saying that it's up to, 30 to 60 days or 90 days? Can somebody answer those questions for me?
So, Ms. Perez, thank you so much for that question. I can't say that for a fact that there haven't been. We know for a fact, because we haven't met the requirement with Indicator 11, that we've gotten 100% of our cases done within the 60-day window. We're about at 95% of that occurring. So we have, there's certain situations that sometimes occur that may create some of those situations to occur. And let me rephrase that. I'll give you an example. If a student comes to our district, is in our district, and the referral process is initiated here, then the student leaves before the referral is completed, but then returns back a couple of years later, back here. It picks up with, that time doesn't stop, right? So that's one way in which you might see an extended time where we go well beyond the 60 days. But I can assure you, from the beginning of the process to placement, which is what we consider completion, is actually placement, or where the staffing has occurred. Most of those situations there were only a few kids where that even happened, and that time beyond does not reach a year, right? So it is of grave concern to us when those situations occur where we don't meet the timeline. And I can speak specifically for myself and this team, our commitment, because every minute matters to the child. And so, because children are most important to us, we want to ensure that we're doing everything that we can to get them the supports that they need as quickly as we can. So what you can get from us today is our commitment to tighten up even more. We want to be at 100% in compliance there. And we will continue to work hard to make that happen, not just because it's compliance, but because it's the right thing to do for kids. So I can't speak to the 3 to 5 years, but I can tell you that one situation where that might occur, but I can tell you our commitment.
How do you report an ESC child's absence when they're sent home? Because this continues to happen. I have reported cases, I have names, that the child is sent home on the school day, constantly, day after day, with an IEP and a 504, and their absences are reported as an absence, and the parents are worried. They're calling me constantly that they're going to be reported to either DCF because their absences are at a high rate. So can you please answer that for me?
So students who are being sent home for behavior, is that what you're talking about?
They have an IEP sent home for behavior.
But I'm asking, is that what you're...
I have no idea. They're being sent home.
If it's for behavior, then they should not be marked absent. They should be marked on that says home for behavior, or they should be suspended. And if they're suspended, we have very strict rules around students with IEPs that at the 11th day of removal, and a removal is parent pickup for behavior, it is ISS, it is any removal from the education related to the disability or not, and if it's related, we have to address it in the IEP. Students should not be marked absent for being sent home with an IEP. So if there are situations that we know about, we will address it with the administrators. We do have a plan to roll out some new training this year to principals and administrators around not just behavior, but the manifestation process, student rights, procedural safeguards, all the APs now. We have a new training that's going to be part of all the new AP induction program and the pipeline that goes over procedural procedural safeguards, student rights, how that relates to the Student Code of Conduct, and MDRs, how that all relates together in services. So we know that that's something we have to get out to administrators. We have, a lot of new administrators who don't know everything about ESE, and that's why we have to help them. So we will make sure we get that information out. But if you have specific cases, we are happy to help those schools to understand what they can and can't do around that.
I do. You stated about grants to states program, preschool. You stated about grants to states program, preschool programs. Are we billing Medicaid for our ESE by any chance?
Yes.
How much in Medicaid dollars did we receive last year?
I did just get a report on that, but I don't have it with me, but I'm happy.
Students that have IEPs,
yes,
and 504s.
I don't know about a 504.
I'm just saying.
Okay. Yes, with IEP.
And who was rejected from this district because his student was nonverbal. But I will take that up with you privately.
Absolutely.
Because I have already, and nothing was done to that because of this. All right. We have, like I mentioned, in the structure of support, parents are not mentioned there. I'm going to keep going really quick. Just a second. The evaluations. We talked about that, 60 to 90 days. Problem-solving process describes students' current skills and abilities in all relevant areas. I noticed that it doesn't have you don't mention collaborating plan.
Anyone that the parent would choose to include at that meeting, from the teachers, caregivers, therapists, evaluators.
That IEP plan is updated once a year, or do you receive updates from parents on a consistent basis?
So the IEP can be updated at any time by the request of the parent or the school.
How often is that request approved from the parent?
How often is the request
from the parent approved? How do they go through the process if they need to update that every 2 months, every month?
So right. So if the parent wants an IEP review earlier than what we have it scheduled for, then they just contact their case manager, and they schedule the meeting.
Okay. And then what's the delay in that time?
There shouldn't be a delay.
Okay. And you said graduation and deferral. We had 2 instances in Lato and Riverview this year where we had 2 students that did not receive their graduation regalia. They didn't even receive the graduation notice. They weren't even in their yearbook because they did not receive information for graduation.
So, Ms. Perez, I can respond to that. Those are a couple of cases that I worked on. Those are situations that result in the way the school distributes information. Again, the student is a gen ed student first. If they're in a school, the same information that was given to all other juniors and seniors was supposed to be given to our students with IEPs. This is why it's so important for us to educate our school administration. It's why it's so important for us to not only educate our special ed teachers, but also our gen ed teachers. Correct. Because we all are responsible for the success of these students, not just the special ed teachers, the special ed department. So I worked on a couple of those cases.
Correct, you did.
And
thank you.
Yeah, absolutely. Because that's what we're here for, to ensure that those things don't happen, so when we know, we respond. But it starts with the school. It starts with the school leadership. And our commitment and support from the superintendent is to be able to get in front of principals to ensure that they understand their responsibility to all students. That includes our students with disabilities.
And actually, the students reached out to me just this past week and let me know that they didn't receive either their certificate of completion or the diploma. They're still waiting on that.
I will talk to you afterwards and get the information, and we will reach out to the school.
And Ms. Perez, those are the same late to interview at the cases you're speaking of. Okay.
Thank you, Chair Perez. Member Washington?
Thank you. Thank you, Vice Chair. First of all, I'd like to thank Shannon and Shelby and Kim, because ESCs is a difficult area to be in. I know that for years, being an administrator. And also thank you too, Mrs. Brown. You made a great point. You see, many times people call down to the district office, but it starts at the school. That the leadership role is so important at schools. And I would like to find out, if I'm a parent, because I have parents call me quite often too, if I'm a parent, who would be my contact person in ESE?
So at the school, it would be their case manager if they have an IEP already, or it could be the ESE specialist at the school, but typically it's their case manager, the person who's managing their IEP. If they're not yet a student with an IEP and the parent wants to alert the school that they have a concern, then typically that is the guidance counselor as their first stop.
Okay, first, because I think that need to be cleared up, because a lot of parents are confused, especially in ESE. You know, they be going to everyone. Mm-hmm. They call the district office, they call the school board members. So we need to have a direct, and principals probably need to let parents know that. I think that's so important for them to know. And can you tell us a little bit about the IEP team, what it consists of?
Yes. Okay. Yes, so the IEP team has, is made up of the mandatory team members. So the parent.
Yes, ma'am.
The ESE teacher, the LEA representative, the evaluation rep, and the gen ed teacher. Did I get them all? Mandatory?
That's it? Okay.
And then anybody else, right, and the student, if appropriate, but then anybody else deemed to have valuable information or input. But the required members are the ones that I stated.
Okay. Now, with the IEP can't be signed unless a parent is not there, right?
Unless they give us permission to go on without them, no.
Okay, good question. So if they say, sometimes, parents, they get caught up with working and a lot of other things they're caught up with when they have the students. If a parent, say if you can't contact the parents, then what happens?
So
'cause I've had that to happen before.
So if we're having difficulty contacting the parent, it's that, we're required to make 3 attempts. We obviously make more than that, but we're required to do 3 attempts. If we don't have any response, then we have to go on without them, because our obligation is to the student, and every student has to have a current IEP by the beginning of the school year.
Okay, good. Next question, then I'm going to stop. How about change of placement? When a student is being changed or placement. Tell us a little bit about that, because I think that's important for us to understand.
Okay, so there's 2 kinds of change of placements.
Okay.
There's change of placement because you need more services, right? So that comes through the IEP team.
Okay.
And then there's a change of placement due to discipline, which I think is what you're kind of talking about. So like I was saying to Member Perez, that on the 11th day of exclusion, we're required to have that manifestation meeting, and what happens at that meeting is if there is a pattern of behavior that's causing these removals, or 10 consecutive days, then you have to look at, is it related or not related to their disability? If it is related, then you can no longer punish or give a consequence for that behavior. You have to address it through the IEP team. If it is not related, then they go through discipline like any other student would.
And they cannot exceed 10 days.
They cannot exceed
for
10
suspension.
days. Right.
Okay, because I had a couple of parents call me. So if they exceed 10 days, then what happens?
You have to come to the table and do the manifestation and determine if it is or is not related. And if it is related, you cannot continue to suspend or consequence for that behavior, and you need to address it through the IEP team. So it could be that maybe they need more services, or maybe they need different accommodations, or whatever through that IEP, but you cannot continue to suspend for that behavior.
Okay, very good. That's good explanations. And last but not least, I think, like I said earlier, ESE is very complicated.
It is.
Because it's a lot of components. And one of the things that I suggest, being a former principal and area superintendent, is that when new administrators come in, we probably need to start training them, because a lot of them don't know the policies and procedures that dealing with AESE, and they might give out, because I've had it happen, they give out a 10-day suspension, and the kid an ESE student. So I suggest that we have training on that. I think that's very important to have training, and some of the new teachers also.
Yes, it's something that really every year we have to readdress, because we have new people, and just like when you were a principal, I'm sure you didn't know everything about ESE. You just don't, and so you have to rely. Yes, so do I sometimes. We all have to rely on the experts, and that's why we need those experts to train. But there is a foundational level of information that all schools and principals need to know.
And I got to add this part. That's why when I was a principal, I always had on my staff somebody that was an ESE person before, like Marie Well. Somebody like I had to have it, because you don't know the policies and procedures.
And they change.
I say, what's going on? Tell me about it.
And they change regularly.
Yes, they do. But thank you anyway. Great job.
Thank you.
Thank you, Member Washington. Member Combs?
Thank you so much. First and foremost, I want to thank all of you for this great resource, this great book. I think it's a great resource that board members can use. And I also want to thank each and every one of you for your hard work, because I think it takes a really special person to be an educator, and then it takes an extra special person to be an ESE educator, and the time and the energy and everything that you can put in. And I think there's no question, we can always improve in anything that we do. That's what we're here for. There's no question. And when you see the 35,000 students that we serve, of course we can find 10 or 11 that missed something or didn't get anything, but let's talk about all the great things that we're doing and the positive things and how we can improve. So some of the things that I want to say is that, it's hard. Shortage of teachers right now. ESE teachers is one of the biggest things. So I don't only want to talk about some of the issues, but I also want to talk about some of the solutions and things that we continue to work on. I think being able to pay people, it's hard that we can't pay sometimes extra with our EPIC centers, where we know a lot of students maybe have ESE needs, or some of our Caminity and some of our centers that, it would be great to be able to even be able to pay people more for what they're doing and all of that work. I think when I look at there was the 2023 Best Practice for Inclusive Education Subcommittee, and they meet every 3 years. And the four big rationales, the four things that they came up with that they needed the most help was the intervention for challenging behavior, the involvement and support for families, the accommodation for students with disabilities, and classroom management. I feel often that we talked about families in this book. When you talk about child find, when you talk about young children, those children aren't advocating for themselves, their parents are. So I feel like in your presentation we talked a lot about that. And then I also feel this in this study that we found that you found a lot of that. And some of the things that you found was consider offering professional development workshops, consider professional development, and also classroom consultation. I think you briefly talked about it, but I think one of the things that you've done as a team that's exceptional is you've really started doing this training for parents. So when we talk about involving parents, it's huge. Yesterday I spoke to an advocate, or someone who has 2 children who has AIDS in our district, in District 1, and the one thing they wanted to tell for me to relate to you is, yes, there's a lot of work to be done, but at her last meeting, 5 of you showed up. and the number of people who are showing up at IEP meetings or the meetings that we talked about some type of trauma, when I was able at Alexander to see some trauma, the type of work that's being done with the small amount of people that we have is very exceptional. So I want to say thank you. We have to continue. As I look over here and I see a parent that comes to our meetings very often to advocate for her children, that's what parents have to do. We have to advocate, and we have to continue to modify, continue to meet the needs of our most exceptional students, especially when often they can't speak for themselves and they can't talk about that. So I do want to say there's a lot of work to be done, and we continue to do that. Some of the things that I'd like to see is, I think, to continue that training, making sure that's, and I think it's available, but to continuing to use our platform to train parents on what she said. It was amazing that you are teaching parents how to advocate for themselves. And that was something that she did not see 3 or 4 years ago, and she's really seeing that, and I think that's major. When we talk about challenges, it's behavior, and that means to increase the number of paras for support. I mean, we've got to put money into that, and that means increasing the number of paras, increasing their pay, and increasing that support and the training. Because you can go to schools, like I go to Citrus Park, and some of my paras are like they are like PhD ESE trainers. So it's the people there who are doing that groundwork work, and I can't tell you some amazing paras that I have throughout all of our schools. Also, fast tracking the situation. I know we're doing 30 and 60 days, but it doesn't happen every year, but it happens where there's a child that is in such need. And I agree with you, Ms. Perez. You don't want to suspend children, and then there's a situation where 27 children aren't learning at all in the classroom. And we're in a bad situation where we're trying to take care of that child's needs because they're exceptional, but all the other students aren't learning. And then there's obviously, where I've seen teachers get bit and hit and hurt. And, I see that it happens. I mean, it happens. And it's really sad for this tiny child who's 7 years old to have rage or pain or whatever they have. It's a very hard, a very complex situation. And when you're having kids being called in Baker Acts at 9, 10 years old, it's a very horrific situation. So I think really working on the behavior. And then the final thing, and I know I don't want to open up this can of worms because it's a huge can of worms, is I'd like to see in-house an attorney. I mean, I know our attorney does a great job, but I think sometimes there's situations where we can de-escalate that situation because we're calling someone on hand. And I know that, I forget the attorney's name, I know she does an amazing job, and I can see the numbers, what you're talking about, but sometimes parents just want things to be resolved, and it doesn't have to be escalated to where we have to go to court for it, or we have to have some type of meeting. Sometimes it's a simple answer of, hey, can I have this advocate, can I have a speech therapist, how can we work with the school better? So I saw that there was an agenda item a couple months ago where the number of increase was substantial, probably 150,000, an increase substantially with our attorney, which I know she does a great job, but I'd like to be able to have somebody, and I challenged someone to find any top 10 large districts that don't have an in-house specialist. I challenge that. And I've said this for years, and I'm not going to keep saying that, but I do think it would rectify a lot of issues when parents are upset or there's a problem. Maybe they don't need an aide. Maybe they need half an aide. Maybe they could share something. So a lot of those issues we should resolve because it can't be a parent against district. We're here, all of us are here at the end. And the parent told me yesterday their child, was nonverbal. And they said 5 words. That might not mean something to someone, but you know what? That would mean the world to me, right? And that means a world. Their child is the most important thing to them. The most important thing to them. So I want to thank your team. We have to continue doing work. I want to find solutions and things that we can work on, policies that follow the federal and state guideline, that make sure that we're not tying ourselves up, that we're making sure that we're doing the best that we can for students. So thank you so much.
Thank you, Member Combs. Member Rendon?
Good morning. I really want to take the opportunity to thank not only this team, but all of our ESC, paras, teachers, all district staff. going above and beyond is making it very little of what you guys do on a daily basis. The fires you put out, the reactions you have to have, you cannot predict what an individual with a disability will do every single day. And yet your team steps up time and time again. And so I think it's notable to make sure we recognize that yourself in this room and then everybody outside and beyond, to the direct staff that are working directly with the students, they are doing a phenomenal job across this district. So with that in mind, my comments are not based upon where we've been, because I do believe, Ms. Esperance, you've done a phenomenal job in trying to put some really good things in practice and build a very significant structure to be able to implement some really good things. But some of the things I think we're in process of. So one of the questions I have is, with the transition indicators, secondary transition, the percentage of students with IEPs age 16 and above with an IEP including that includes appropriate measurable post-secondary goals that are annually updated and based upon the age-appropriate transition assessment, transition services, including courses of study, and that will reasonably enable the student to meet those post-secondary goals, the annual IEP goals, and related to the student's transition service goals. Is that directly related to when they are still in our school system, or does that include when they leave?
It's when they leave.
And so, according to this, we're saying 100% of our individuals' goals are met when they leave, and that they are obtaining some kind of post-secondary appropriate placement, whether that is through a variety of services. Is that what we're saying?
So I'm sorry, you were looking at 13. So the 13 is like our but isn't it like the self-assessment? Is that what that? Yeah, this is called the self-assessment, and we have to, the state looks at our IEPs, and they determine if we've met those transition services outlined in the IEP, and we meet that at 100%. I thought you were talking about the ones for post-secondary.
That's fine. So when you say that, and you say that the state mandates and monitors, and what are they considering met for a transition goal?
Michelle Carell is going to come and answer your question. She's our coordinator for transition, our expert.
Thank you. All right, I need to already apologize that this is the voice I'm working with. So forgive me. Can the question be repeated just so I make sure I answer it fully?
Absolutely, no problem. So on the indicator number 13, it talks about 100% of our goals regarding transition. I believe I'm stating this correctly, Ms. Lesperance, please correct me if I'm wrong, but the post-secondary goals and annual IEP goals related to students' transitions are being met 100%. And so I'm asking exactly what those transition goals would look like, that the state is saying we are meeting that 100%.
So what they are saying is that, what they're saying is that the goals are indicated on the IEP. They're talking about the components that are required by the state mandate. And in some case, they're talking about post-secondary, not post-secondary, daily living skills, as that's not a requirement for all goals.
So what happens is they take a sample, right? So they'll say, you're going to send us these IEPs from these student numbers. We upload those IEPs, and they review them, and they determine if we have written appropriate goals and that we're meeting the requirements. So when they say 100%, it's 100% of whatever students they ask for to review the sample. Maybe that will be helpful.
Yeah, no, I understand. I think what I was trying to understand is, so it's really not about the student proficiency in this standard. It's really about the goals that we wrote that will be appropriate. Am I correct?
Yes, that we're writing appropriate goals in transition.
Yeah. Okay, so this doesn't really dictate the actual student's transition. It's just about what we wrote on an IEP.
Right, because that's what we're monitored on, that we meet all the criteria that's required in that transition goal.
Okay. Thank you so much. The next thing is, Member Vaughn talked about the 35,000 and that 15% indicator. May I clarify, when we talk about that 35,599, because we are also looking at providing through some of our grant subsidies, that we are providing services to both charter and private, does that 35,599 include both charter and private as well, so that we would be basing that on the 240,000, not the 180,000 in our current district?
Yes, it includes charter, but it does not include private.
And so our charter number would be that 230,000. Am I correct, Mr. Superintendent?
It's 224.
Okay, but that would be where that 15% comes in. It's not, the 180 is just our current student population, 184.
Somebody confirm.
Yeah, and that's your 15%. So if you go 35,000 into 224,000 gives you that 15%, 15.6 approximate. So you're correct.
Okay. I just wanted to clarify that it was not just art within Hillsborough County. A couple of different things we talked about of being proactive instead of reactive, and I'm very excited about that. I think that's huge. But one of the difficulty in doing that is we have struggled as a district in our certified behavior analyst really being able to, I want to say, completely implement their role within our schools. We have a very small number of behavior analysts compared to the number of schools that we have, compared to the number of ESC classrooms or classrooms where we have a student with a 504 or an IEP. And so how are we going to be proactive if we don't have the correct management of staff to get out there, to get in a classroom, be able to provide a plan for a teacher to be able to implement, to be proactive from when that student is engaging in that classroom and they're being able to react from a therapeutic behavioral point of view? How does that look when we don't have the staff or the capability of our behavior analysts or even our RBTs, enough of them to get out there and implement plans that are individualized per student?
So I will agree, we don't have a lot of BCBAs, but what we do is we take those experts and they train our other staff to help with implementation. In addition, we do have 4 RBTs that we have not hired yet, but we are going to be advertising to work directly with those BCBAs so that they can go and help support the schools. But remember, our regional staff, their focus is going to be instruction and behavior, and they're kind of our boots on the ground in addition to our program staff, district resource teachers and supervisors, and the BCBAs. So while we don't have a lot of them, they are very powerful in training our staff to go out and support the schools.
Could I just add that we have a Para 3 position. We partner with USF and provide the means for the Registered Behavior Tech course and the certification. Those Para 3s are then managed by the BCBAs and go through their competencies and then sit for their exam. So we've been building that in the regions to support in those schools. So if a student requires that level of support, immediately the principal, assistant principal, specialist, case manager reaches out to the region teams. We failed earlier to talk about a wonderful piece that are in our region teams that I think pairs nicely with some of your questions, and that is our parent liaison project that is through Fiddlers. And so each of the region offices also has a parent liaison assigned to the regions to support those families. That region parent liaison attends all of the monthly meetings, attends parent IEPs. If that parent liaison, I'll use my wonderful one that I just left before I took this position, she will come to my office. She's there every day before she goes into the schools to support. We talk about cases. She may get a referral from the manager of that project, Ms. Valdez, who then reaches out to the individualized schools. A lot of calls come into Fiddlers and go through that piece. So if the parent is saying my child is misbehaving and they've gotten it to the parent liaison walks 2 offices down to find one of the team members that supports the region team to process that. So we also have an internal process where schools can submit for an additional adult support request. Each of the region teams have access to that, and the schools have access to that. They pair any information that they have, and we immediately then look at the needs of the student. What's currently there? We already look at their schedules, what staff is assigned, what their level of expertise is, and then what else do we need to address the unique needs of the student. That could be an additional adult support through a unique needs aid. It could be a para 3 and giving that specified registered behavior tech training and support, which then is managed by the BCBA. So we have, again, tiered levels of support depending on the needs of the student. And not always are the needs at those sites where we have full-time programs, where we're already addressing complex needs. These are students that maybe are just entering into kindergarten and developmentally are requiring supports because they haven't had any early intervention. So the continuum is very wide for the levels. So that region team is the immediate support to the school-based team. We meet with the region teams every week, and then the program teams meet with the region supervisors. The compliance side of the house is meeting with those, so that we are in a holistic approach of assessing what a particular need. Every principal, I would say in all the regions, have access to the cell phone of the supervisor, and we hand that out freely to all administrators so that they can access us. We have just gone through the reorg that Ms. Les Brown spoke of, and we have shared out that with our regional superintendents and the site administrators so they know immediately who to contact. That transition will take place starting July 1. So just speaking on the level of behavior and the tiered spaces in which we provide support, those are some of the additional pieces.
And Ms. Rendon, when Shelley was talking about the para 3s, we will have para 3s that will be on the district staff to help, but many schools have para 3s assigned to them to support students. And then our BCBAs that work for the district level, like on our team, we have 6 units, but we have several school psychologists who are also BCBAs assigned to schools, and so they are also assisting with individual students at their own site.
And thank you very much for the lengthy explanation. I'm going to have to resort back a little bit because when I look at the true process, at the end of the day, it's really about that student in that classroom and that teacher. And if we don't give those tools to that classroom, we're not going to be successful. It's going to be beyond calling a team. It's going to be beyond that. So the RBTs and our para 3s, it's wonderful that they've got that behavior assistant training. That means they're going to have reactive strategies. That means they're going to be able to implement the process of a plan. But if we don't give those teachers and those direct classrooms the tools, and our regional superintendents, our principals, our admins don't always have the tools because they're not certified behavior analysts. And although our psychiatrists, I'm thrilled they do, some of them do, have behavioral training. Many of them only have the doctoral training and not the actual BCBA training where they can actually create and develop a plan based upon a reinforcement schedule, based upon the distinction between a disability behavior and a behavior itself of a standard behavior. And so that's where my concern comes in. We see a high level of behaviors where we're having individuals suspended over 10 days. It is what I would consider an epidemic within our district and how we need to approach it. So what I would look towards is how, and you won't have this answer today, and I'm not asking for the answer today, but could we look towards a plan of exactly what that looks like on paper, where we are actually implementing behavior plans in our classrooms and giving teachers tools that they're going to be able to use in their classroom that's going to assist them with an individual with a disability in their classroom as well as other gen ed students. That is something we're lacking right now because, again, our lack of CBAs are they're handling crisis, they're responding to crisis, and they're not ahead of the game, being able to give those teachers those tools. So if we could look into how we could do that for the future, that would be very helpful.
Yes, absolutely.
Because all of this, like we said from the very beginning, is very high level, and I appreciate that. I appreciate that knowledge, but I really want to know, how is that high level affecting the classroom? Because we talk a lot about the IEP team, we talk a lot about the district staff, but at the end of the day, I need to hear and understand in the future. I'm not asking for today. How does that flow so that we're giving the tools to the teachers? Because if we talk to any of our teachers within our classrooms, they don't feel they have the tools to support the individuals with disabilities and the gen ed students at the same time. And so that's where I'm looking for a solution moving forward. If we could look towards that, that would be very helpful.
Absolutely.
One of my other things is, I'm very excited about all the wonderful and positive things that you guys have talked about in this presentation. But I want to ask you the question, had a lot of good, but where do you see this as far as our ESC department as a whole? Where is our need for improvement, and how are we going to move forward on that?
So we have some room for improvement in a few areas. I would say closing the gap in ELA and math for all our students, specifically our students with disabilities. So that's why we have an emphasis on Shelley's team to really become the experts in specially designed instruction. We've recently initiated a new project to focus on middle and high schools, because last few years we've really hit elementary hard with BrainSpring and making sure that they have Orton-Gillingham methodology for reading in the early years, but then we get to middle and high school and it's not just about providing accommodations. We for so long were heavy in co-teaching and support facilitating, which are all great, but what's happening in that room needs to be very specific to the student. And so we have been training our middle and high school teachers on what specially designed instruction is. How does it look in an English class? What should you be doing as the ESE teacher during that time? It should be different. So it should be something that is going to address the goal of the student. So if they're not reading in middle and high, then we still have an obligation to teach them to read and to access the gen ed curriculum. So we've recently trained people in structures, which is an Orton-Gillingham methodology specific to secondary students, and iSpire for high school, and making sure that we can fit that in their day. We cannot close the gap if we just continue to provide accommodations. We have to provide access, but we still have to provide that direct instruction, and we can do that in middle and high school, but we have to teach our teachers how to do that, because for so long they've been there as another content expert, and we don't need two content experts. We need a content expert in the gen ed teacher, and we need our ESE teachers to be experts in specially designed instruction and how to close the gap for those students. That is a big emphasis for us next year, in addition to behavior. And then on the compliance side, really helping our teachers understand the cyclical process of the IEP. You write an IEP, but then it's not just sitting and writing it one day and putting it away. It's the implementation, and how do you take that specially designed instruction piece now? That's why these two assistant directors are working so closely together, because it all is cyclical. You write those goals, then you have to implement that specially designed instruction using research-based curriculum, collect the data, go back and evaluate when needed, and then you come back to that IEP team again. It's got to be cyclical. We have to support that within the schools. So to your point that our teachers, it has to get to the teachers, yes, it does. They have to be able to write a good quality IEP with the support of the parent, and then they have to implement it, provide data, and and come back to that IEP team. So we are really focused on that for next year, in addition to, like I said, really becoming a better partner with our parents and having some focus groups and working with them to make our program even better.
Thank you for that. I just have a couple additional things. One is, when we talk about our number 14 on our transition indicators, how do you actually track that data?
Nabil will tell you how we track it. It's very interesting.
It's actually the states that track the data.
Push your button.
Sorry. It's the states that track the data after they leave us. So sometimes through Social Security number, through different ways, that's how they do. And once they leave us, it's very hard for us to collect data on them. But that's how they get those numbers.
So knowing that there are 21,000 individuals waiting for services, and out of that 21,000, over 14,000 are individuals in the state of Florida that are actually at that transition point of 18 to 22 and do not have services. That's where my concern comes in with that data, because they may have Medicaid, and that would be how they would be able to track their Social Security and things, but that won't be able to track their direct intervention. So thank you for letting me know that.
Member Rendon? Can I just interrupt for 1 second? I hate to interrupt you. I just wanted to let you know we only have about 10 minutes left in the meeting, and we still have 3 members left in the queue. So if there's any questions that can be answered afterwards, I'm going to highlight some of those as well. I just wanted to give you a time update so we all have a chance to ask an additional question. Thank you.
Thanks, I appreciate that.
Can I also add, because of that number, that it doesn't consider students that leave the state of Florida. So they might go somewhere else, and then they might get employed and get, but they're probably not counted in there. So as well. So.
Okay, thank you, Member Vaughn. I have one more question. How is this department going to bridge the gap? Because I think when Member Perez and Member Combs, we talked about individuals not getting that service in that 30 to 60 days because of the fact we hear complaints, and when we talk to people, I think there's a gap between the discussions from a classroom and recognizing an issue and feeling empowered with their administration to really move forward on getting those evaluations and moving forward on the possibility of an individual with a disability or working in IEP. So how is this department bridging that gap of empowering our teachers, whether they're ESE teachers or gen ed teachers, to really get the support from their admins to move forward on evaluations and things like that? Because I think that's where a large gap is, that they don't feel supported and empowered to be able to get that for their students.
So I think that comes back to that continuum from when the discovery occurs, and that could be some training for our new teachers to understand that, hey, I suspect this kid has a disability, what do I do next, right? But that 30, 60-day time from when the child is suspected, we have 30 days to meet as a child study team. And at that time, that child study team, including the parent, would decide if we would move forward with a referral or not. And once that referral is initiated, then we have the 60 days to get that evaluation completed. I will tell you that indicator 11, there is a work group in Hillsborough that works on that, including student services and ESE. And we've worked very closely with Synergy as well to help us with these timelines, because sometimes it's just a matter of alerting that we're getting close, right? Or those kinds of things. Or we're waiting for something. That happens too. I know that we're not at the 100%, but we're at 90, almost at 96%. That's not, I mean, we want to be at 100, but there are going to be times where things are delayed because maybe kids have health issues and they're not at school when we need to evaluate them. It could be that we've done one evaluation, but then that evaluation we have to come back and say we need some more supporting documents, or maybe we need a social history now, and we weren't really, because you have to evaluate in all the areas of suspected disabilities, and as you start digging, you might suspect something different, and so that might require a different evaluation. So I think, to answer your question, we need more training for our staff to understand, what do I do when I suspect a student has a disability, and what are those things that hold us up? We often hear, well, they're in the process of, do that side by side with an evaluation. So if a parent comes and asks for an evaluation, oftentimes our schools feel like they have to say that they're implementing these interventions first. Well, that is a mandated requirement for a lot of our eligibility criteria. It shouldn't hold up the process, but that could be a training issue for us.
Thank you. Thank you very much for all of you.
Thank you, Member Rendon. Seeing that we only have 6 minutes left, and there are 3 of us, myself, Member Graham, Chair Perez, and the queue, I'm going to go ahead and put a 2-minute per. Mine's on. It's just off there. I didn't do anything. Per Chair Perez, the 3 that are left in the queue right now are going to do 2 minutes each. So I'm going to start my own 2 minutes quickly. So first of all, I want to agree with the fellow board. Seem like, there's only a few kids that we're talking about that may not be the many, but it is important for us to understand what it looks like and how it works so we can be that liaison with the community. The questions that I'd like to follow up with, and I'm not going to ask for you to explain now because we do have a time limit and I want to be aware of that, is really what it looks like for our families where English isn't the first language, to make sure they're supported through this process, because I know that's been a barrier in some of the situations. So I'd like to know what that looks like and how we can make sure that's accessible. As well as where I'm confused, what we've talked about here is our success centers and whether or not students with IEPs who should have a place of environment into our success centers, because I know some have, and based on this information, it sounds like that's not an appropriate change of placement for them. So I'd like to understand that process. So those are the 2 things that I would definitely like to get some follow-up answers on. So aside from that, again, I appreciate it. I've got 8 seconds left. Thank you so much for everything. And Member Gray, you have 2 minutes.
Mm-hmm. Thank you. Come on. Thank you. Can you all hear me? Okay. Board members have given great insight into what they're hearing and what they're synthesizing, and I recognize all of you are taking notes, and I appreciate that and appreciate your work and it's just so impressive, your skill sets and your dedication and your passion, because this is a group of children that need the passion and the high level of professionalism. When you have goals, area of focus for 24-25, I would say one area would be the area, the culture of professionalism. We need to make sure that as professional as you all are standing out, and we're just very, very impressed, we want that whole department to have professionalism. And that means professional development, not only as you have concurred and board members have mentioned, we certainly do need the teachers to have this dosage. I don't know, I'm not going to ask, well, tell me later, but if we have scheduled PD during this summer, maybe you could just shake your head. Yeah, okay, it is in there. Okay, and the principals and Superintendent Van Ayers, you know that we do have many new principals, maybe 60%, 40%. But nonetheless, when you talk about things such as the inclusionary PBIS, positive behavior incentive support system. We want those children to be in that part of that. But the discipline, we cannot have any more of these stories that show one child, Member Combs, versus, disrupting the class dramatically because of the needs, the ESE needs, versus the 23 other students. So somewhere we gotta make sure that's taken care of, because that's the biggest frustration that occurs. And I think that's going to be a big challenge. Okay, so that's my alarm clock. I can't do anything in 2 minutes, but I tried. Prompts. Okay. All right. There we go.
Thank you, Member Gray. Chair Perez.
Yes. It's 75 million people in the last year have been diagnosed on the spectrum. 75 million. That is and the numbers increase. So I understand your jobs. Thank you so much for what you do for this district, for our students, and for our students that continue to age out, and go into adulthood. I appreciate it. How many current vacancies do we have?
So I don't have the exact number.
That's
of
fine.
vacancies.
You could get back to me on that. Second is on our website. Do we have the names of the staff that the parents could, connect with? Is it on the website? Is it easily accessible? Can the parents just, connect with you?
Yes, it is on our website, and we're in the process of updating that right now.
Okay.
Yes.
Okay. All right. Because that's all the parents are asking for, is that accessibility, that ability to connect with you, and to be able to, not fan these flames to kill these flames, that because they're advocating for their students. And thank you for this workshop. Thank you for this presentation. And with that, this meeting is adjourned.
We'll do a follow-up with all the questions back to everyone.